Health Talk Live with Liz, sponsored by TriHealth.
Good afternoon once again in Health Talk Live. Today we are talking about how hospitals are handling this COVID-19 surge. Joining us now through Zoom, Marla Santos Silliman with TriHealth. She is the Senior Vice President of Hospital Operations. Good Samaritan is her region. Thank you so much for joining us. Thank you for your team helping so many people. What are you seeing right now?
Well, we're definitely seeing an increase, higher than ever before. You know, this summer we were watching those numbers around 25 to 30, and now we're pretty high, getting into the 170s or so across our hospitals. So it's really daily management of these patients and being prepared for almost anything that can come through the ER.
So how are you sort of managing sort of the backup plan? I know, can you send people that are non-COVID cases elsewhere? Can you have emergency management teams come in? What's sort of the day-to-day plan?
Well, I think at TriHealth, the health systems throughout the region, we're really trying to take care of our own. We have a number of ERs and hospitals, so we talk regularly and make sure that if we have to transfer patients around to balance things out, we do. And we look at the numbers regularly. We flex to add beds, to bring in staff. We have a lot of our staff who have taken on overtime shifts to help us through it. And when we can release and let go for a few hours, we do. But mostly we're managing a steady increase the last few weeks.
Mm-hmm. And I'm just curious, who are you seeing? Is it a different population than sort of in the March through April surge?
Yeah, now it's really traversing everywhere, but we certainly have some of the younger ages. We are seeing the 40s and 50s. It's not just the nursing home population, and there's just a lot of them. And so most of our medical surgical floors are filling with coronavirus, and not just the ICUs as we once thought early on.
All right, quick thing. I just want to ask you from your team's perspective, how grateful are you that a vaccine may be right around the corner?
It is our hope. What we're really doing is planning for the surge the next few months while we can't wait for that vaccine to come. So
yeah, we are hearing that healthcare providers will be getting it first, and you certainly deserve it for putting your lives at risk for so many of us for so long. Dr. Marla, we want to say thank you for just being here with us on this noon show and for all that your team is doing. TriHealth has not had to cancel or reschedule elective surgeries as of yet, correct?
We haven't. We have our eye on it. We're being very thoughtful as to how do we balance it all. So we know that day will come, but we haven't as of today.
All right, good news, and we are following your work. Thank you very much for joining us. And we, of course, would love to hear from you. Tell me what you're talking about, coronavirus or anything else. We have great experts, as you can hear from in this every noon on Wednesday. We'd love to have you shoot me an email, hit me up on Facebook or Twitter. That address @LBonis1.